Hello, this is Dr. Gay from First Sec MRI, and this is a 75-year-old female who has had left hip pain for about a year. She finally went to her orthopedic surgeon, and they ordered an MRI of her left hip. And to get our anatomy here, we see her left femoral head, which is round. It sits in the acetabulum, this cup here, part of the ilium, this big bone. We see the femoral head. Here's the neck that gets narrow. We have the greater trochanter here. This along the medial or inner side is the lesser trochanter. And here we see her femoral shaft going down the leg. We see the muscles. This is a medial side. The adductor muscles come down here to the medial side. And here we see the muscles on the outer lateral side. And this is a fat suppressed view on the right. So this is bright subcutaneous fat, light bulb bright. Over here we see the fat dark. Marrow, which is normally bright, is going to be dark on this one. And we see that something jumps out here. This is fluid. Here fluid looks dark. Here it looks bright. So now we're oriented between the anatomy or the views here and signal. And so now we're going to try to figure out what is going on with her. So we see on this view her greater trochanter is not round and smooth. The lesser trochanter, see how nice and smooth and uniform that is? We see the black cortex. The greater trochanter looks more irregular and it looks broad like areas of spurring. So this is chronic change associated with either an old injury at the gluteus attachments here or chronic inflammation, maybe partial tearing and tendinopathy and reactive bony hypertrophy and spurring here of the greater trochanter. So it looks like a chronic trochanteric bursitis with some acute changes of fluid. We call this acute upon chronic trochanteric bursitis with reactive bony changes. And we see that fluid right there where the tendons should attach. So they're partially torn and fluid accumulated there. There's a bursa here that can also be inflamed, and this may be partly related to the fluid in the bursa. But again, this is trochanteric bursitis is what we would call it. Now there's something wrong with her muscles here. So the muscles down here are dark. Up here they're white. So this is fat completely filling these muscle groups here. There's the deep one here, the gluteus minimus muscle. And then over the top of that, we have the gluteus medius muscle. So gluteus medius and gluteus minimus, more deep. They blend together. It's hard to tell them apart. But there's a deep one and superficial gluteus minimus and medius. Now the subcutaneous fat is over the top. It looks very similar to the muscle, but we can tell it apart by this iliotibial band. It goes all the way down to the knee, and it separates the subcutaneous fat from the muscles here deep. So complete fatty atrophy of these muscle groups. These come down to attach right on that greater trochanter. So they're partially torn off and have that fluid signal associated with them or inflamed at the attachment. Now the gluteus maximus, the biggest muscle, heaviest muscle in the body is right here. The gluteus maximus muscle comes back down around, wraps over, goes behind the femur, and then it comes down here and attaches to a couple areas. Number one, the iliotibial band, this broad sheet. This fascia coming down here, it attaches to that. And it also comes back behind the femur and attaches to the back of the femur, right along the back margin. And if we go towards the back, we'll see this area right back here, a little area of darkness, which is unusual, and that's right at the lower attachment. This is part of the muscle coming over, and right there, this little round ball is right where that attaches. So we're going to put up a sagittal view to look at this better. Here's a coronal view that shows that little unusual area of darkness. Here we go. So here is the sagittal view. Here's the front, back. This is the femur. We see the cortex. The periosteum covers that, and right behind the periosteum we have this round ball. And it's right at that gluteus maximus attachment. So this looks like probably an area of an old injury where the gluteus maximus was partially torn from the attachment and a little hematoma developed. And the hematoma can go on to sometimes ossify. We call it myositis ossificans. So it looks like an injury with a myositis ossificans. There's also some edema in the adjacent adductor muscles. And so an unusual case of probable myositis ossificans from the gluteus maximus attachment, as well as acute upon chronic trochanteric bursitis with marked atrophy of the gluteus minimus and medius muscles. And that's it. Thank you very much.